We have a burning platform. Healthcare is in a state of disruption. It is extremely expensive in every country. We are seeing health systems around the world that do not have enough money to care for our populations, our patients, our communities. We have a burning platform, and that means we don't have a choice but to look at technology. We cannot go back to the way things were. We don't have that opportunity anymore. Everything has changed. The world that we left before the pandemic is gone. The workforce has changed, patients have changed, families have changed. Everything is different. We have no choice but to figure out what is the right way, what are the right technologies, and how do we as nurses innovate the way that we provide care. I want to give you a paradigm. I want you to think about the fact that up until about 1919, the way that human beings got around was by riding a horse or being pulled by a cart attached to a horse. We then saw Henry Ford that developed a car, the Model T. And he developed that because he knew a faster horse wasn't the answer. It had to be different. And what we saw was that we were able to go from point A to point B safer and faster and warmer and drier than ever before. We also know that the modern day car is even far superior to the Model T. It allows us to go faster, to move more people, to be far safer than the old Model Ts of the past. And yet, take a look at where we are today. We now have autonomous vehicles that do not even require a driver. I live in Austin, Texas. We have autonomous taxis, so you can call it up on your phone and there's no driver. The taxi will show up and pick you up and take you wherever you want to go with no driver. It's not just the future, it's where we are today. So when you think about this paradigm, I want you to think about how it's changed the way humans interact and how it's improved the outcomes. Now, let's take that a step farther. And as we think about transportation, we used to use human beings that made vehicles by hand. They used a variety of tools to put nuts and bolts and parts on these cars on an assembly line. It took hours. They created a vehicle. Nowadays, what we see is that across the world, this happens through robots. Robots are smarter and faster and safer and more accurate than human beings. So, where have the human beings gone? The human beings are in the control centers managing the computers that guide and direct the robots. So, when we think about patient care, it will always take human beings to interface directly with our patients. However, we need to think about how we're going to start to pull human beings back into this higher order thinking and these higher level positions so that we can utilize the tools that we have through artificial intelligence and through other technologies so that we don't use humans where we don't need to. We have to pull humans out of billing and coding and registering patients. We have to pull human beings out of staffing and scheduling. We need to pull humans out of even some patient education because we know we can automate that. Yet, our nurses, our clinicians still have to be available to help patients. I do not believe for 1 minute that a future that we set all patients up with 1-800 numbers to call for problems, I don't think that's going to be successful. I do think there are opportunities that we have to really begin to leverage technology through virtual care by supporting our nurses, by supporting our clinicians that are absolutely going to make care safer and better for us to deliver than today. So I want to leave you some things to think about here. 5 steps. I want you to think about what are the solutions that you have access to that you could optimize? And in most organizations or healthcare systems, whether you're the NHS, whether you're in Portugal, whether you're in a large system here in the United States, there are currently things that you have available to you. Are those things truly optimized? That's a place to start because it generally doesn't cost more money. Think about how you're going to transform care in your organization and convene people to begin to talk about this on a monthly basis. What does care look like next year, or in 2 years, or in 5 years? And how are you going to get there? What is the problem that your organization is trying to solve? Is it a lack of nurses? Is it patients not showing up for visits? Is it that your turnover rate is high? Is it that your readmission rate is high? Think about the problem you're trying to solve. And as you begin to explore technology, make sure you fully take the advantage of demos to look at what's out there and identify multiple solutions. And then create a roadmap on how you're going to get there. These are things where you have to think very strategically about how you are going to go from year 2025 to year 2030. And it can't be a little bit of this and a little bit of that. You have to be a little thoughtful on this, what this strategic plan looks like and how you're going to go from point A to point B. Use a roadmap for that. Your team that you develop for your Care Transformation Council, they should be helping with that work. That's interdisciplinary work. That's doctors and nurses and finance people and therapists getting together and figuring out what does the future of care look like in our organization and how are we going to get there. So with that, please feel free. These will take you to my LinkedIn. I am available out there for any questions that you might have. Thank you so much. And Sarah, I'm going to stop my share and go back to you and see if we have any questions.
Excellent. Thank you so much, Bonnie. That was an excellent talk, and I think we all learned a lot during that time. So we do have a few questions from the audience today. The first one I'm going to ask you is, how do you think technology, as you described it, can be used effectively in low resource settings? And this person mentioned sustainability, affordability, accessibility, the technology, and then also literacy as considerations.
Yep, those are really great questions. What's really cool is that you don't have to spend millions of dollars to be able to provide virtual care. You think about it, if you have the access to a phone or a tablet, you do need internet, right? So the ability to access internet is going to be crucial here, but it doesn't have to be the $1 million technology. We absolutely see very, very successful models, whereas it doesn't take a clinician to be the one to drive out to a remote village or a remote community with a tablet to set that up and be present while you have a conversation with the patient via the tablet, with a physician or with a midwife or with a nurse. So there are ways to deploy that. From a tech literacy perspective, this is an opportunity, and I would even challenge all of you at Lecturio to think about how you can develop content that helps clinicians understand what the technology is that can support them and what's on the back end of that. And by that, Sarah, I mean, how do we educate nurses, physicians, and other clinicians on how is AI developed and what are the biases they should look for so they understand when they use it, how will they know if it's guiding them correctly?
Yes, absolutely. Thank you for that. I have another question for you, which is what do you believe the risks are of all of this tech being hacked?
The risks are real. So we can't pretend that they're not there. They're absolutely real. I think that that's a huge concern in all of our organizations. And continually trying to stay one step ahead of the hackers with really good cybersecurity practices is the best we have today. I think for me, there's kind of additional risks that begin to pop up, and that is that AI has gotten so creepy good at replicating or simulating fakes from fake providers, whether it's a fake nurse or a fake physician, I think we're going to have to develop ways to really understand what we should be looking for and how we can shore that up. So for me, that's a real concern that we have to think about.
Absolutely. We also have a question, and we had some discussion I saw about this in the chat about convincing senior doctors and nurses to use AI and the way that level of resistance had a linear relationship with age. We also had some comments in the chat that said that the folks in the older age groups were more accepting of AI than perhaps some of the audience might have expected. So, can you speak to that?
Yeah, I hate to stereotype demographics, but we do see strong resistance almost from that 50 plus age group. And yet, at the same time, I will tell you, in many organizations that deploy virtual care models, if they have virtual nurses, virtual RTs, virtual case managers, care coordinators, pharmacists, we're finding that the employees in the disciplines, so for example, let's talk about virtual nursing. If you're a virtual nurse or if you're a nurse and you are retiring or thinking about retiring, those absolutely are amazing virtual nurses because now they're practicing nursing remotely, supporting the younger nurses who are the boots on the ground. So we are seeing in those scenarios, there is high excitement and willingness to adopt technology. So I think some of this is going to be continued education, explaining what it does, what it can't do, and how to use it. And we're literally going to have to win hearts and minds one at a time because we don't have the choice.
Yeah. Okay, last question, and then I'm going to give some follow-up information to our participants. So, when you've talked about improving the education of nurses and new nurses, are you talking about increasing the complexity of what they're learning, or are we talking about improving the methods that we're using to deliver that curriculum?
I think it's yes to both. I think the world has changed a lot. And while many schools of nursing and schools of medicine have kept up or are ahead of that curve, it's not true of all of them. So I think we really have to take a look at how are our schools educating the future workforce? What does that education look like? Not only does the content need to be refreshed, do the educational methods need to be updated? And how do we create a workforce that is prepared? Literally, if you are in nursing school now, when you graduate, you are graduating into a world of virtual nursing. Are we even teaching them that? Do they even know when they come out and they're going to be a med-surg nurse? What is it like to work with a nurse that's watching you and helping provide you advice and telling you that your labs have a problem? Are we preparing the workforce the right way? And I think there's a tremendous opportunity to do that better.